Jacob.
Hi.
Let's face it, you're intimidating, you and doctors, to many patients. How do we get comfortable with you and remember what we want to talk about?
Well, I think it was an excellent point. The concept of writing down your questions and bringing them in with you to your prenatal visits is a great way to do it. If you're trying to spend the time to remember the questions that you want to know, it's difficult to feel like you have the time to ask all the questions. If you write them down, it gives us a chance to go point by point through your issues, and it really helps.
Here's another question for you. You know the old adage, once a C-section, always a C-section. Is cesarean required once you've had one, myth or fact?
Well, absolutely not. You don't need to have a C-section just because you've had a C-section before. There are circumstances where you might have to have a C-section because of your previous C-section, but that's the exception rather than the rule. We're really encouraging now moms to consider vaginal delivery after a C-section. And I can tell you, you talk to our moms who deliver vaginally after the fact, they're much happier that they had a vaginal delivery than their C-section.
There are a lot of choices that now have to be made at the time of birthing, like how you're going to do it. You can go to classes to find out the best way for you. You can do Bradley, Lamaze. There are many options. How does a couple pick what's right for them?
Well, that's such an individual choice. It's hard for me as the practitioner to know what's right for an individual family member. We really advocate family-centered care, getting dads involved, getting family members involved in the delivery as is needed during the process. We tell our patients at their first prenatal visit that they need to think about where they're going to go for their childbirth education to get prepared for their childbirth. So we try to get our patients into childbirth classes in the middle part of their pregnancy. They finish those up around 30, 32 weeks, and then they're ready in case they deliver a couple of weeks early.
Okay, and how about breastfeeding? I think we all know that there are the advantages outweighing the disadvantages, but when does an expectant mother start preparing for the breastfeeding experience?
Well, again, I think that's something that needs to start early. It's not something that moms find a really relaxing thing. So we encourage our moms to think about breastfeeding their very first prenatal visit. We mention it on a kind of an intermittent basis throughout the remainder of their pregnancy. And then come 24, 25 weeks, we try to get those moms that are still a little bit uncomfortable with the concept into a breastfeeding class so that they can make a nice, smooth transition from being a pregnant mom to being a breastfeeding mom.
You talk about transitions. How about lifestyle transitions, changes in the amount of exercise you do?
Well, a lot of people feel like they need to be very, very careful during their pregnancy, and so therefore they should just kind of insulate themselves from the real world and hide. And that's really the wrong thing to do. We tell our patients that they can maintain the same exercise level during pregnancy that they were doing before. Tell them not to go out and train for a triathlon if they've never trained for it before, but they can certainly continue any kind of exercise activities that they were using before their pregnancy.
If they weren't doing any exercise at all, should they think about doing some when they're pregnant?
Absolutely. Some low-level, non-strenuous activity is very beneficial for moms, both during their pregnancy and during their labor process.
Prenatal care is a term we hear a lot of now, and we know that it's critical to the success of a healthy birth. But when should it begin, and what does that entail?
Well, you're exactly right. Prenatal care is the single most important aspect of a healthy pregnancy outcome. Moms should be in to see their obstetrician or their care provider within the first part of the first trimester, preferably before 10 weeks. At that visit, we have a chance to do the risk assessment, to identify the medical interventions that may be necessary to promote and foster an optimal pregnancy outcome. Obviously, then we're going to have the patients come back on a regular basis to make sure that the baby's growing appropriately, their mom's medical condition hasn't changed in any fashion, and by getting good education during the pregnancy, by getting in early for their prenatal care, we can really facilitate and foster the best pregnancy outcome available.
Dr. Jacob, thank you very much for joining us and giving us some ideas on how to have a healthy and safe pregnancy.
Remember now, you can use the booklet that came with this program to review key points and to take notes. You'll also find a resource guide and a glossary of terms that might be helpful.
And that concludes our series of reports on pregnancy. We wish you well.
I hope we have done our job and that you are better informed. The knowledge you have gained should help prepare you for decisions you may have to make. It can also help you sort out any additional information you receive, whether it is from well-meaning friends or the evening news. Facing what you or a loved one is going through right now involves taking personal responsibility. Responsibility for keeping in touch with your doctor and other health professionals and for following their instructions. And of course, responsibility for getting the support you need to cope with certain issues. For all of us with Time Life Medical, thank you for turning to us at this time in your life.
To help you access important information that was covered in this program, you may refer to your personal workbook. You may also find additional information related to your situation in other Time Life medical videos.